Ebusia for hey UK TV Ghana so na mo hwe. UK TV Ghana no mape at the moment news update. Yetu bata ababe PM CSIR Research Staff Association Southern Zone, which is today have to be the sweetest month in all months, which is 14 February. Until 14 February so a month of love. CSIR and paying for aye to make for fair February ye donated blood. Ama the abwa a friend saying ayare sabia ane akwankra se na be ye menu ni na ye kwa ebenya moja na ye dia support ye. Intende ye baya dwumedi fefefe we ti na ye baaye. Inti me pacho monje bre na monhwe na ye course.
My name is Professor Paul Busu. I'm the Director General of CSIR. You know, CSIR is a national scientific research organization with 13 institutes and a head office where we are, and several other affiliates bodies. And so today we all know it's a very significant day. The 14th of February is a day of love. And though many times we want to think that it's solely about romantic love, it goes far beyond that. And so on this day, the Research Staff Association of CSI, the Southern Sector, decided to mark the day with the blood donation. And it couldn't have been nobler than that, because to support the National Blood Bank, to create awareness about the importance of blood donation for saving lives and many others. So we have, in CSI, we have chosen to observe the Valentine's Day with the donation of blood to support the National Blood Bank. First of all, if you remember at the short ceremony we had this morning, we were informed of the benefits of donating blood. One of which obviously is that then you get signed up as a donor, so that in case of a situation where you need blood, and if you show, then at least you have a priority. We were also informed that blood is not sold, so that's why we donate it. We don't pay for it, or we don't ask for payment for it. We were also informed that when you donate blood, you stand to benefit in some ways your health. Sometimes certain individuals, by donating blood, they are helping to maintain the right kind of balance in their system. Sometimes if you have, maybe you have too much, or you have certain conditions, donating blood, we are informed, actually helps the individual. So that is that. In recent memory, I'm sure we might have done it. CSIR, here we are, is the head office. And we have the biomedical and public health and COVID lab here, where we did that. But we have 13 other places, maybe more, our field stations with different groups. I believe that if we should check the records, it might have been done at some point. But in recent memory, at the head office, this is the one that I recall we are doing for some time now. I don't think the Research Staff Association anticipated the interests that we are seeing today, and noble as it is, I think management would encourage them to make it an annual affair. If it's not only the Southern Sector of the Research Staff Association, we also have other groups, other associations, like the Senior Staff Association. We have the CAG group, accountants and marketers, and that group. We have the TUC, We have the ladies club, and so we will get in and encourage them to organize such programs. Maybe not even only annual, because we need the blood all year round, as we were informed this morning. So we will consider that. Yeah. This morning during the lunch, the figures, I don't have the figures, but the impression I got from the man from the Ghana Blood Bank, Blood Service, is that, and I think this is not a secret, we all know that the demand for blood is far outstripping the, let me use the word, supply that they are getting. That there's almost always a shortage of blood to handle emergency situations at Kolebu, I'm sure, in other places. He is hopeful that if we can donate this today in all the places that they are doing, if they can donate 1,000 pints or 1,000 units thereabouts, or they are expecting that they will donate enough to last at least a week and maybe 2 weeks. And so I urge all Ghanaians of all lives, all persuasions, if you, especially those that are within this airport residential area enclave, I will urge all CSIR staff. Today is ceremonial, it's a special day, but it shouldn't be just on ceremonial or special days. Anywhere you are, anytime you find the need, please go and donate blood so that people who are in need, we may not be able to give them money to buy medicines, but as for blood, as long as we are cleared to be able to do so, we should do so. I wish all Ghanaians happy Vals Day.
I am the president of the CSIR Research Staff Association at the Southern Zone. So Southern Zone, we are referring to Greater Accra, Central Region, Eastern Region, and then Western Region. So we form the Southern Zone of the Research Staff Association, CSIR. We put together this event primarily to promote preventive health care. Our research showed that generally after the 20th century biomedical revolution, which emphasized on preventive health care as one of the tools to stop the spread of diseases and then malnutrition, we haven't placed emphasis on it that much until recently that COVID came in and everybody had to prevent infection through hand washing and then wearing of nose mask. So learning or picking up from the COVID lessons, we want to encourage our members and then our associates, family members, friends, and then Ghanaians to think preventive. So in preventive, we have adopted 2 ways. The first is to donate blood, one to scientifically replenish the blood in our system, because as we give our excess blood in our body, the body within 24 hours replenishes it to give new blood for the healthy functioning of the human body. And then 2, we also want to avoid health risk factors, or what we call risk factors of cancer, contracting other health diseases due to excess blood count in the human body. And so that is the second benefits we are seeking to achieve in this exercise. And thirdly, to provide blood that will help the sick at the hospital. So the sick, we are referring to patients that have been admitted to the hospital, accident patients, malnutrition, people who need blood, pregnant women, and all. Pregnant women are not sick, but anyone who needs blood at the hospital should be able to get access to blood when they need it. And we are trying to contribute in a small way to help meet the blood demands of Ghanaians at the hospital. The other approach that we want to adopt in preventing diseases amongst our members and then our friends and families and loved ones is the screening for COVID-19. So now it's hard. Our research experts have told us the symptoms of COVID hardly show nowadays. So we are saying that our members should screen for COVID regularly so that we can detect the infection as early as possible to reduce the spread or to cut down on the spread of COVID-19 at the offices and then in our homes and then the country at large. So basically, this is our way of looking at preventive health care in a small way, but we know that there are several approaches to preventive health care that others can adopt at homes, avoiding other practices that will cause us to fall sick. So we should prevent or avoid practices that will lead to sickness so that we don't overpopulate the hospitals. Even though they are there for us and the doctors are there for us, we want to encourage all to stay away from activities and practices that will make us fall sick and cause us to visit the hospital regularly. So a healthy you makes a healthy nation. Thank you.
My name is Dr. Samuel Amo. I'm a senior research scientist with the Biomedical and Public Health Research Unit of the Council for Scientific and Industrial Research. You are very much welcome to our Valentine's Day event. So this event is being organized by the Research Staff Association of the Council for Scientific and Industrial Research. It's supposed to show love, and so we wanted to do it in a special way, that on the Valentine's Day we do a blood donation exercise where people, the general public can donate blood, and also staff of the CSIR can donate blood to help save lives. Also, we're also focusing on preventive health care. We have a COVID-19 testing facility here. You can see the building here isn't accredited. So today we are giving free COVID-19 testing to students in the secondary school students, and also people in the general public about 50 years. We are giving free COVID-19 testing to them, and this is a way of helping give back to the society. Okay, so basically it's a love feast. We are showing love to the community and to Ghana on this special day, blood donation and then COVID-19 screening. Because COVID-19 still persists, we just don't do COVID-19 testing. We are doing screening of COVID-19, and apart from the clinical samples that we do, okay, we also have what we call environmental surveillance, environmental screening of COVID-19. And if you follow the media, you realize that recently when there was an outbreak of COVID-19 in China, one of the interventions was that all the wastewater that's in the airport, they should screen for COVID-19. Because if somebody has the disease, okay, if somebody has the virus, you will release that virus in your urine and also your stool samples. So if you still have it, even though you don't come to me to test, we can detect it in your urine or your stool samples. And we've been doing that. CSIR has been leading that together with our partners. We have been doing the environmental surveillance. And I'm telling you, as we pick samples now, and we are still finding COVID-19, RNA in the wastewater sample. So it is still with us. But we want to do on this day of Valentine, we want to show love and do free COVID-19 testing for the general public. The Research Association has been with us for some time. So every year they have an activity. Last year was a sporting activity. So this year, this is how they want to show love. So it's not maybe depending on the response, next year they will do the same thing. But our purpose is to reach out to the society to influence them. So if there's a lot of requests for this thing to be repeated, yes, we don't mind doing it every year. But that will depend on the response that comes. We are looking at diseases apart from COVID-19. We are looking at malaria. We are looking at neglected tropical diseases. So the neglected tropical diseases, they include river blindness. those who know about river blindness. It includes bilharzia or schistosomiasis. It includes filariasis, so lymphatic filariasis, and then even worm infestations. So all those ones, we do research, and then we look at, okay, which interventions can be used to help reduce the burden of these diseases. Example, sometimes some of these drugs, some of these diseases, we are using a particular drug that has been imported for many years. We have a pharmacology unit that looks at what local interventions, what local drugs can you use to solve these problems. Okay, so it is all about Ghanaian scientists dedicating their lives to fighting public health disease by using innovative Ghanaian techniques. So basically, that is what we do here.
Well, the experience has been nice. First, you have to write your name, and they'll give you a form. You write your name and fill in some basic information that they would determine whether you are fit to donate. And then they'll take some sample of your blood and test whether you have enough blood to donate. And when you have gone through all those and you are fit, then you'll be asked to go and then you will donate. It's my token of love to someone who is in need of blood to survive. And I pray that my blood will actually support somebody to live. Especially with my blood group, which is O positive, I should be able to give to anybody. Yeah.
So as a nation, we need about 350,000 units of blood yearly before we can adequately save lives of our people who need blood transfusion therapy to live again. But we are not meeting the target. Last year, we made about 175,000 here. So this year, we are hoping to meet the target. We cannot say completely. Every day we have shortage. We are not meeting the target. So every day we need more people to come and donate. We are not meeting the target. But we can't say there's complete no blood. People come in to donate every day.
Hey, UK TV Ghana. Wait till I follow you with all the social media platforms. Midin, Daniel Kweku, Mensa, what's me from me? Kweku DB, Madam Asi.